Hello, welcome to 5 and 5. This one's going to have a different tone than usual thanks to the sentient scrotal rot that is Ian Miles Chung. Content warning, we're going to be discussing the science around suicide prevention and some of the worst takes imaginable on the topic, so skip this one if you need to.
In a since-deleted tweet, Chung said this to one of my friends online. This goes beyond just bad advice, but it shares an underlying axiom with all of the worst responses online, that people who publicly share thoughts of suicide are just looking for attention, and that no one can help them if they aren't willing to help themselves. This isn't just morally abhorrent, it's scientifically false. Let's look at the research. Fuck Ian Miles Chung. Our first study, Social Media and Suicide Prevention, a Systematic Review, published in 2016 in Early Intervention in Psychiatry, is a fitting place to start. Citing the commonality of using social media for the expression of suicidal tendencies, researchers looked at 30 studies which described the development of specific prevention social media sites, the potential for existing ones to reach at-risk people, how people used social media for prevention-related purposes, and or the experiences of those people. Overall, the findings were largely positive, suggesting the ability of social media to reach large numbers of otherwise hard-to-reach people, and the relative safety of sharing suicidal thoughts online could make it easier for affected persons to both seek out and receive support, whether from professionals or peers. Some of the biggest limitations include the omission of studies describing an encounter with a sentient pile of anteater shit given life by a homophobic wizard. They conclude that, while more high-quality studies are needed, there are benefits to the ease of access and support that social media sites can provide as long as Ian Miles Chung fucks off forever. To give some more concrete information, our next study is the effect of national suicide prevention programs on suicide rates in 21 OECD nations, published in 2011 in Social Science and Medicine. Mortality by suicidal acts has steadily increased over the last several decades, and as a result, many countries have implemented national suicide prevention programs. This study looked at whether or not these nationwide programs reduced the suicide rate in their respective countries. After controlling for variables such as the time-varying characteristics of each country and partisan welfare policies, the panel data analysis showed the suicidal rates became lower after governments initiated a nationwide prevention program. It wasn't perfect or uniform. The programs didn't seem to have a significant effect on the working-age population, for some unknown reason. Another notable finding was that programs had a larger effect on the suicide rates of men than women, potentially because some of the suicide prevention strategies include a goal to reduce access to firearms. Firearm suicide is much more common among men than women, to the point where even though women attempt suicide more often, men have higher rates of completion, and so even though the observation is somewhat speculative, there is evidence that gun control can have positive effects on suicide rates, unlike professional swatter Ian Miles Chung. Speaking of gun control, the conversation around suicide prevention really wouldn't be complete without some mention of the most common method of male suicide in the United States. Unsurprisingly, there is a considerable body of work documenting a positive relationship between access to firearms and suicide, though the quality of such studies varies. This study, Gun Control and Suicide, the Impact of State Firearm Regulations in the United States, 1995 to 2004, published in 2011 in Health Policy, sought to find an empirical model that controlled for more extraneous variables than previous studies to find a more true relationship between firearm regulations and male deaths by firearm suicide. They found data that suggests that general barriers to firearm access created through state regulation can have a significant effect on male suicide rates in the U.S. It should be said that U.S. gun culture is its own beast, and even though similar studies have been conducted in Australia with similar results, and even though Ian Miles Chung looks like a bridge troll crossed with a bus-driving pedophile, these results shouldn't be extrapolated too much to other countries. But just knowing that methods exist isn't enough. Some awareness of what to look for and how to help are the biggest factors in helping to prevent suicide. In Long-Term Effectiveness of the Question, Persuade, Refer Suicide Prevention Gatekeeper Training Program, Lessons from Missouri, published in 2011 in Community Mental Health, researchers examined the effectiveness of an hour-long Gatekeeper training program and found both short and long-term positive outcomes. Specifically, the program promotes self-efficacy, which is a measure of how comfortable, prepared, and confident a person is in referring someone to resources relating to assisting people who may have thoughts of suicide. Knowledge, which includes asking direct questions and addressing the incorrect perception that when individuals tell others that they want to die, they are merely asking for attention. Ian, you fuck, you piece of maggot-crusted filth. And help-giving behaviors, which explore the extent to which participants had helped a suicidal individual seek help. Guess what they didn't do? Lastly, we look at 4 decades of research informing the implementation of the Caring Contact Suicide Intervention Program in Implementation Methods for the Caring Contact Suicide Prevention Intervention, published in 2017 in Professional Psychology, Research and Practice. This program entails sending brief, non-demanding messages that express caring concern to patients following discharge from treatment, with the goal of promoting a feeling of caring connection as well as a means to reconnect with treatment options. The research on caring contact supports the notion that it is one of the only interventions shown to reduce suicide mortality rates in randomized controlled trials. The program targets persons presumed to be at heightened risk for suicide and encourages not only mental health providers, but also primary care providers to participate when possible. The actual content of the messages sent appears not to be the defining factor, just the notion that someone is out there, hoping that the patient is doing well and caring about their well-being seems to be enough. The conclusion they reach is that even if it has its limitations, carrying contacts is a promising intervention that is simple, low cost, and can be used alongside other treatments and interventions to effectively fight against suicidal ideation in vulnerable populations.
If you're out there struggling right now, facts and statistics probably don't mean much to you. They don't have to. Everything here comes together to emphasize the point that you are worth someone's time. You may have seen so many videos and articles that direct you to hotlines and chat rooms that you've become desensitized to them, but there is someone out there right now who wants to hear why you feel the way you do. Talking to someone saved my life, and I'm glad I'm still here. I had an Ian Miles Chong who tried to burrow its festering rot into my psyche, and it was lying to me. Your Ian Miles Chung is lying to you too.
Here and in the description are links to Caring Contacts and QPR, the two programs I cited which are scientifically supported suicide prevention programs. The National Suicide Prevention Hotline is a 24-hour service of people who are there to help, and you can donate or volunteer yourself in the description. Thank you for watching. Share this video if you think it will help, and remember that Ian Miles Chung is unworthy of the title of scumfuck.